Good afternoon. We will present a multiplex fever diagnostic for febrile illness that are difficult to diagnose and manage. The core team include Ethan Guillen, Terry Roberts, and Oscar Bernal, but this project involves a lot in experts from MSF and outside MSF. Introduction. Fever is the most common problem in low-income and middle-income countries. Is a very common cause of admission and mortality, and MSF medical team face more than 178,000 patients per year with difficult to diagnose fever. MSF need to switch from a syndromic approach to an etiological management of fever. Potential solution: a multiplex diagnostic platform looks to test for biomarkers to identify bacterial versus no bacterial, detect fever causing pathogen specific, and assess antibiotic susceptibility. The MFD has to be affordable, robust, and open source to improve changes and permanent improvement of the test. Projects underway. There are different projects in the component of RDTs. There are projects that are more focused on the differentiation between malaria and bacterial and no bacterial biomarkers, some specific about bacterial and no bacterials, and some markers on severity. There are a mini lab that is focused on simplify blood culture, and there are the MFD, that is the project we are presenting today. Different initiatives inside MSF that include MSF eCare and Almanac that help the clinician to take decisions. We have looking to different type of RDTs, OCBA, and University of Toronto looking for markers for severity, and other more focused on antimicrobial resistance. This project already reviewed more than 440 companies, and among them 20 were a project similar to the one we are presenting, but any of them really prioritize the settings in MSF and the needs of MSF. Methods. We developed a feasibility study examining the patient need, the clinician needs, then potential funding, technical and regulatory requirement. Target product profile was developed, the initial one, with input from MSF and stakeholders. And we are interviewing different diagnostic companies. Ethics. This innovation project did not involve human participation or their individual data, and MSF ethic framework is used in every step of this project. Results: MFD, intended use, detection, identification of priority pathogens, ability to differentiate between bacterial and no-bacterial infection, and support the diagnostic support the clinicians in the diagnostic of and management of undifferentiated febrile illness with sign of severity. The target use settings is MSF hospital with the basic equipment, with enough trained personnel, water, electricity, and medical staff on site. The target population is all patients, adult children, HIV positive or negative patients, malnourished children. And the MFD system will combine techniques, molecular and serological, to detect nucleic acid, biomarkers, and antigens. The results: there are already a draft of a list of pathogens. We include pathogens with high prevalence in MSF settings, with high mortality, and the possibility to do something that the fact we do an etiological diagnosis will change the treatment. That include Salmonella, Staphylococcus, Leptospira, Escherichia coli, rickettsia, etc. We will not include the list of hemorrhagic viral fevers. We only include Lassa fever because it has a difficulty, it's including the difficulty causes of fever to diagnose. In terms of funding, the total project is expected to cost $100 million. The initial investment in MSF is $2 million. Then there are the proof of concept, the prototype build, and regulatory and approval and field validation. The idea is once MSF have a good TPP, we need the involvement of other organizations. We don't expect that the MSF cover the complete cost of this process. Conclusion, a program to develop a MFD is feasible. A convincing business case for the project that MSF needs has been created, and we have already partnership with outside organizations, including FINE and other organizations, WHO, in this project. The next steps via WHO, we will develop a consensus process for the TPP, including need to detect antibiotic resistance, prioritization of pathogens, the cause that cause difficult to diagnose non-specific febrile illness in more MSF hospital settings, menu of different cartridge because due to a different context and population, we need to have different possibilities or different menus to detect pathogens. And we need to then define and identify how the MFD will change clinical practice and improve patient care, and compile data from different the final decision of moving forward of this process. If that doesn't happen, anyway, we believe that to put together all this information about management of fever is already very important for MSF. We have to say that already in this process has been involved different stakeholders, including Access Campaign, Epicentro, DNDi, FINE, Halter Associate, Accenture, and others stakeholders, and we will need to involve a lot more stakeholders because it's a very challenging process, but we believe is possible and it's a necessity for MSF. Thank you very much.